patient is asked to lay in the supine position with extended legs. The probe is oriented in the transverse plane over the femoral vessels at the apex of the femoral triangle in the upper third of the anterior thigh. This apex corresponds to the convergence of the sartorius muscle and the adductor longus muscle. Color Doppler may be used to detect the vessels if they are not immediately apparent, and the image should be optimized. First attention is paid to the femoral vein. At the apex of the triangle, the femoral vein lays dorsally to the artery. The femoral vein receives the deep femoral vein and forms the common femoral vein. This confluence is distal to the saphenofemoral junction and distal to the bifurcation of the femoral artery and deep femoral artery. The common femoral vein becomes medial as the probe is moved towards the inguinal ligament. The long saphenous vein joins the common femoral vein. This confluence is distal to the bifurcation of the femoral artery and deep femoral artery. Having identified the saphenofemoral junction and its tributaries, which are superficial external pudendal vein, superficial epigastric vein, and superficial circumflex iliac vein, we follow the course of the common femoral vein toward the inguinal ligament. Parallel and lateral to the femoral vein lies the femoral artery. The femoral artery gives rise to the deep femoral artery just above the saphenofemoral junction. After the passage through the vascular lacuna underneath the inguinal ligament, the femoral vein and artery continue as the external iliac vein and artery. The external iliac vein receives inferior epigastric vein, which is accompanied by an inferior epigastric artery. Now we will focus at the course of the femoral artery descending along the dorsal part of the femoral triangle, from its base to its apex. At the level of the inguinal ligament, the external iliac artery continues as the femoral artery. Important branches of the femoral artery inside the femoral triangle are the superficial external pudendal artery, superficial epigastric artery, and superficial circumflex iliac artery. Slightly distally, femoral artery gives rise to the deep femoral artery. The saphenofemoral junction is distal to this bifurcation. Approximately at the level of saphenofemoral junction, the medial and lateral circumflex femoral arteries arise from deep femoral artery. As the probe moves towards the apex, femoral artery becomes ventrally to the femoral vein. Using Doppler, the conjunction of femoral vein and deep femoral vein is demonstrated at the apex.